I am Dr. Ram Narayan, Senior Consultant Restorative Neurosurgeon. What is this restorative neurosurgery? This is a new branch of neurosurgery which involves surgical management of lost nervous functions. Nervous functions get lost due to various conditions like Parkinson's disease, like stroke, paralysis, so many conditions. So nowadays, by surgical methods, we can restore this lost nervous functions. As we all know, conditions like stroke, conditions like incontinence, conditions like even addiction, all these have a lot of not only medical problems but also a lot of social connotations. A lot of lives get lost because of this. A lot of financial problems happen. So by surgery, especially in those resistant cases where no other treatment is possible, by surgical methods we can help these patients get back to a normal life. Now I will talk to you about another common problem which is called failed back surgery syndrome. As the name implies, somebody has a back pain, back surgery, but unfortunately due to some reasons the surgery fails. I will tell you why the surgery fails. The common reasons for failure are, one of the common reasons is that the anatomy is not normal. It looks different in different people. Of course, none of us there's no correct 100% correct patient, correct person. Everybody will have some defect somewhere. That is one common problem. Another common problem is you cannot do exactly what you want, what you started. Due to the anatomy being abnormal, due to various reasons you cannot do what you want. And then the other bigger problem which we call is called arachnoiditis. That is, some people have a tendency to form unwanted excessive scars. For example, we have seen people who had a bypass surgery. In some people there's no scar, nothing is visible. But in some people it becomes very big. The scar grows. Okay, so again when you do surgery in the back, some people the scar grows. So like that, then the canal and all the spinal canal and all will be so tight that it can cause multiple injuries. It can cause damage to the nerves and all that. So there are various reasons to the cause of the failed back syndrome. Of course, we always have to think of legal issues also, litigation issues also. This also has to be kept in mind. Some people, in spite of having a good relief, will claim that they still have back pain and create trouble. So this also has to be kept in mind. So failed back syndrome, how do you treat this? Usually what happens is patient has a back problem, they go to a surgeon, they get operated, but unfortunately he is there, do well for a few months, but unfortunately the pain comes back, or the pain never gets reduced, or they develop new problems. So how do you manage this problem? One is, of course, we have to find out what exactly is the problem. For example, in some people it may be instability. So if there is instability, you have to stabilize the spine. That is usually done by the spine surgeons. And then there are other conditions, as I said, there are like scar formation on that. Of course, there are surgeries which remove the scars, but invariably the scars come back. In such situations, what do you do? And especially if there are no other problems other than the severe pain, there are two ways of managing this problem, but both these are surgical managements. If there's only back pain, severe back pain, not controlled by anything else, like medicines or conservative management or any other things which should be tried before the surgery, then we give an option of what is called as intrathecal morphine pump. We put a pump under the skin here and deliver morphine directly into the painful area. As we all know, morphine is the best painkiller known to man, and it works very well, and because it is put directly into the spinal cord, it does not cause any problems in like addiction or other complications like constipation or things like that. This is very effective in some patients. Of course, we have to choose the correct patient by doing a trial injection before, and if the injection is very effective, then we could do the intrathecal morphine. But in some patients, what happens is there's back pain also, and then there's associated pain going to the legs also. We call it radiating pain. In these patients, the best surgery offered is what's called spinal cord stimulation. Spinal cord stimulation is putting a stimulator in the spinal cord, outside the spinal cord, and putting a battery in the lower abdomen and stimulating. This spinal cord stimulation will ensure that the pain sensation is not felt by the patient. Again, this is internationally approved, both these are internationally approved surgeries, and in fact the NICE, that is the National Institute of Clinical Excellence of the UK, recommends that never do a spine surgery again unless you prove that there is instability. Otherwise, they always ask for a spinal cord stimulation surgery to be done. This is a very simple surgery, and again a trial is always done before the surgery to select the correct patient. And this is also a simple, so such a simple surgery that the patient can go home next day morning. And the results are very good in the properly selected patients. Thank you very much.